Welcome to Israel Healthcare Highlights, where we share important information about Israeli healthcare with English-speaking audiences around the world. My special guest today is Professor Dorit Nitzan of Ben-Gurion University, and we'll be hearing from her about some of the public health challenges Israel has faced in the wake of the war and how its resilience and is dealing with it. So let's start. Dorit, please tell us a bit about yourself.
Thank you. Thank you very much. I'm really honored to be here and to be with all of you. I'm back to Israel. I think, 2.5 years ago, I came back to Israel after more than 17 years in the World Health Organization, in WHO, where I served as the emergency director for the regional office in Europe, covering for 53 member states, including Israel. And before I was the WHO representative to Ukraine, to Serbia, and before I was in the Ministry of Health in Israel. I'm a pediatrician, public health, and a nutritionist in my background.
Okay, and your current role?
My current role, I'm the director of the School of Public Health in Ben-Gurion University, and also heading the master's program in emergency medicine in the university, in the School of Public Health here in Israel.
Terrific. And Dorit is really one of the leaders of public health here in Israel. So please tell us a bit about some of the challenges Israel's been facing and how resilience is playing a role.
Yes, so I would like to start with some private experience that I saw during that period. My daughter, Maya, and the family are from Netiv HaSara, and Netiv HaSara is bordering Gaza from the north. And they were there on the 7th of October, but they were saved and came to us right after that. Many of their friends, neighbors, colleagues from the village, but also from other places around Gaza, were actually experienced this ripple effect. And this ripple effect, I just saw, just like a stone that is thrown into the water, I saw the waves coming out in this eccentric motion, and more and more and more layers were discovered to us through the period. It wasn't new to me because I saw it also in other emergencies in Syria, in Ethiopia, Sudan, Ukraine, but also older ones in the former Yugoslavia, where you think the first day you think about one circle of vulnerability, and then you go into the next and next and next. I think that, if you go to the next slide, you can see the concentric and eccentric figure, how it moves to and out of the system. So in the next one, you can see that the first one, the first circle, is the direct victims. And usually in the first day or two, we are focused on those vulnerable ones, those that were wounded and kidnapped and left behind, but also very close to them, the families, their good friends and neighbors. All of them require urgent care, immediate care. And here, the health system really had to receive and provide everything that is needed. But the main thing that we see everywhere in the world is that the care of those vulnerable people in the immediate circles usually starts with the community. It's not new that the communities themselves serve as the first lifesavers, also for emotional, mental, but physical needs of those victims, direct victims. We saw it very well in Israel all through the first stages of the war, where the communities gathered everything to help, from moving the patient, the injured into the hospitals, caring for each other, and the families holding on to each other. So the direct victims, families, and communities are the immediate circles. Then we move in every emergency. It could be earthquakes, it could be fires, and everything else. You go into the regional impact, because the whole region needs to absorb and be ready and to care for each other. And in our case in Israel, it went countrywide, and also with the Jewish diaspora, we see the global impact. And this global impact continues until today. The thing is that there are so many circles that you can add them more and more as you go, and the longer the war or the emergency, the longer the circles of vulnerability get. They really expand, and the number of circles are added onto. The interesting thing is also that the direct victims could also be part of the countrywide. You move from one circle to the other, from day to day, from situation to situation. The issue is that resilience also works in these ripples. And in the next slide, you can see how resilience, the ability to bounce back, that is resilience, to counteract the emergency that hits so hard. Resilience also works in these circles, in those circles of vulnerability. And for that, a resilient system needs to be prepared in advance. And that brings us to the beauty, if I may say, of the Israeli health system. In Israel, we have a universal health coverage, health system that is accessible to all at all times through all levels of care, and the ability to absorb emergencies has been increased from one emergency to the other. And the COVID, for example, prepared the system to deal with emergencies in many aspects, because the core capacities that health systems need in order to withstand emergencies were acquired through the years, but also through COVID. And the Israeli health system acted very quickly, very well, and was able to receive, absorb, and learn from it very quickly. The circles of vulnerabilities, the people themselves, the injured got into the adequate care settings, including rehabilitation later on. The families and the neighbors, the neighborhoods can get their help, etc. What we did see during this time, as opposed to other times, is the magnitude of impact on mental and emotional health. And the impact here is actually making it very hard on us to respond adequately. For that, we learned in Israel that we have to strengthen the communities themselves. And in the next slide, you can see that we established in our university, but with the support of Magen David Adom, which is the emergency medical system of Israel, with the local and central government, with the health funds, which are running our health services, and the defense forces. We established what we call collab, or in English, I like to call it collab, like collaboration. But collab means close to home in our slang, but also קהילה למען בריאות, which is community for health. And here, what we have learned is that while the areas, the communities around Gaza suffered first, we wanted the others in the north and in the east to be prepared for escalation in that areas. And here, together with the communities, we established network of volunteers. In each of the communities, the networks of volunteers get trained in order to be able to save lives. So we established different tools, and what we found out that we need a lot of support in mental health. So we trained in the communities the volunteers that stepped out, and enlisted themselves and wanted to be trained. They got trained to provide mental health support to the families, to the children, and to those in need. And wherever there is an event that something happened, the social workers, the mental health workers help each other to come together. The health funds and others are helping us to maintain it later on and get all the care into the system. So the first days, the communities are self-maintained.
That's fascinating. Could you go a bit more about how the university played a role?
The university, our university, in the beginning, many of our students, because we are in the south, we are not so far from Gaza, many in our university live in those areas that were impacted. So they were at the center of the circle of vulnerability. We have students that were kidnapped. We have staff that were killed, and also students. Everything happened here. But in our team, in the Masters in Emergency program, we amalgamated those who wanted to volunteer to join us in that project. And the project, the Calab project, what they did with us, they went from one community to the other. We spoke to them about their ability to volunteer and to help each other. And it was absolutely amazing to see when you come to a community, you meet with the security. In Israel, in each of those communities, there is a safety and security team that is ready. We told them that we want to help them to save lives. And there we asked all volunteers from the communities that want to join. They enlisted themselves on simple Excel sheets. We wrote like how many physicians, how many nurses, how many social workers, engineers, secretaries, whoever, teachers, many teachers, by the way, whoever wants to volunteer actually stepped into and provided their name and got trained in the different areas that they wanted to support. So our students help them to train and organize the training, the official trainings.
Okay, one last question before we wrap up. Here we are over 600 days since this war has broken out. What are you seeing now, both among your students and in the communities?
I see that, first of all, many people are tired and exhausted. We have many that their partners are in reserve, young families sometimes with children. They are exhausted and they need support. We also have those who were injured and they need support during that time. We have those in the reserve. And also our students, many of them, we have Arabs, and different religions here. And it's beautiful. We are all together, studying together, helping each other. And that's beautiful to see. And Some are very involved in the humanitarian aid and trying to help the people in Gaza. And some are very helping each others and very involved in their own communities. So everybody finds their space, and they are all taking their projects to study and to do what we need to do.
Dorit, thank you so much. This was very informative and very inspiring. Do you have any last thought you'd like to leave us with?
Yeah, the last thought is that I think that our students, not only here in Ben-Gurion, also in the Hebrew University, in Tel Aviv, Haifa, everywhere, and also abroad, it's very good that we are working together. We're getting lots of help from communities in the US and in Europe, and we are very grateful because that actually gives us hope that we are all one humanity.
Thank you so much.